Good morning, everyone, and welcome to Stay COVID Safe, Stay Open KC's COVIDSafe Program. My name is Sadia Ali. I am a COVIDSafe Project Officer at the City of KC, and I will be your MC today. Firstly, I would like to introduce Courtney Boy, Council's Aboriginal Engagement Coordinator, to deliver the acknowledgement of country.
Thank you, Sadia. The City of KC proudly acknowledges the traditional owners, KC's Aboriginal communities and their rich culture, and pays respect to their elders past and present. We acknowledge Aboriginal people as Australia's first people and as the traditional owners and custodians of the land on which we work and live. Thanks again, Sadia.
Thank you, Courtney. I would like to acknowledge our special guests who have taken time out of their busy schedules to be part of today's webinar. These include Minister Sean Lane, MP from the State Government, Commissioner Andrew Crisp, APM, Emergency Management Victoria, Vivian Noyen, Chairperson Victorian Multicultural Commission, and Dr. Nadia Chaves, Infectious Disease Specialist, CoHealth, a community health organization. They will all be sharing their reflection surrounding the impact of COVID-19 and how this has affected KC's community. I would now like to introduce Minister Sean Lane, MP. Minister Lane is the member for Eastern Metropolitan Region and the Minister for the Local Government. He is responsible for overseeing the system of local government in Victoria. Minister Lane acts as an advocate for local government issues within the state government and supports and monitors the system of local government with the assistance of Local Government Victoria. He joins us today to shed some light on how the state government has been supporting our diverse communities and businesses in KC. Minister Lane, welcome to the City of KC.
Hello, everyone. It's been a challenging couple of years for all of us. Victorians have shown remarkable resilience and community spirit through lockdowns and restrictions as we adapted to COVID normal life. As the Minister for Local Government, I'm proud to see how councils stepped up to help. Councils understood the specific needs of local communities and then acted to address them. KC Council did this through a range of different measures. For example, helping emergency relief groups recruit and train volunteers. Recognising the issues of food insecurity in our community, councils also work with the Belgium Group on an initiative brought together private businesses, cafes, charities to support the community. They also supported the state government as we introduced a range of programs designed to encourage businesses and the community to safely adjust to life during the pandemic. For example, our COVIDSafe Business Fund allocated close to $7.1 million to establish the local government business concierge and hospitality support program in 78 councils across Victoria. I was delighted when, due to its huge success, this program was extended last November to continue through summer. This funding helps councils hire COVID business support officers who actively help businesses, especially in the hospitality sector, to comply with public health directions and requirements for COVID-safe settings. These officers were able to support places of high density or high risk, like markets, shopping strips, hairdressers and butchers, for information for customers on things like checking in, physical distancing, face masks and sanitising. Since the start of the program, they have visited almost 700 businesses in KC. Thanks to the council, especially all the COVID support staff, for your hard work. Wishing you all the best for the coming year and have a great event.
Thank you, Minister, for your time and insight. It is of great value. The COVIDSafe program in KC was introduced in June 2021, and since then our team of COVIDSafe project officers have assisted service providers to engage community venues and local businesses on COVIDSafe practices and provided data and intelligence to the Department for use in COVIDSafe response planning. To know more about COVIDSafe program, its achievements, and what has been delivered so far, let's watch a short video describing KC's COVIDSafe program.
The COVIDSafe program was developed to help support businesses and culturally and linguistically diverse community groups to stay safe and stay open throughout the COVID-19 pandemic. We are supporting hundreds of businesses with information and resources to ensure all members of our community understand their roles and responsibilities in staying safe and staying open. The COVIDSafe program provides relevant, accessible and meaningful support where it has been needed the most. With the support of the Victorian State Government, the City of Casey established the COVIDSafe program to support high-risk businesses and culturally and linguistically diverse community groups to navigate the complexities of changing COVIDSafe requirements throughout the pandemic. To ensure the businesses stay COVID safe and stay open, we have provided support with COVIDSafe plans, QR code check-in requirements, density limits, hygiene practices, social distancing, COVIDSafe posters and flyers. Along with site visits, phone and email support, the program has assisted businesses and culturally and linguistically diverse community groups by providing a dedicated webpage that offers translated and up-to-date resources, a suite of multilingual animated videos that clearly explain COVIDSafe requirements, and pop-up information desks at community centres and hubs that offer information about vaccination requirements and status. Throughout 2021, our COVIDSafe program officers have made nearly 600 in-person visits to local businesses and reached out to over 3,360 contacts across the City of Casey. By providing personal, accessible and culturally appropriate support and advice, the COVIDSafe program has assisted local businesses and community groups to remain open and to continue to fulfill their vital role within the Casey community. We are extremely proud of our Casey community for their collaboration and patience during these challenging times.
Stay COVID safe, stay open. Stay COVID safe, stay open.
Stay COVID safe.
Stay open.
برای بازماندن بزنستان از کووید 19 محفوظ بمانید.
لنحمي أنفسنا من كورونا فيروس ونتابع حياتنا.
Stay open. Stay open.
Stay open. Stay open.
Stay COVID safe, stay open.
It is amazing to see what has been achieved through disseminating the COVID-safe messages to our local businesses and diverse community networks. This video is available on our COVIDSafe webpage with multilingual translated captions for our culturally and linguistically diverse business owners, should you want to share this with others. Council have also been actively engaged with the Department of Jobs, Precincts and Regions, and acknowledging the quality of our work and outcomes from this program, we have built a great relationship. Direct business engagement support has been delivered through co-site visits to our local and high-risk businesses, in-language information bulletins for our called business owners, multilingual resources, and COVID-safe plans for businesses. The City of Casey acknowledges the impact of COVID-19. Our COVIDSafe program remained flexible during its delivery throughout changing restrictions and reached out to businesses and called community groups through various channels. The program aimed to engage with our Aboriginal and Torres Strait Islander community, seeking to understand the need and level of support required. Moving forward, Council will continue to support our local businesses and called community groups. Useful links and contact details will be provided at the end of this webinar. I would now like to welcome our first keynote speaker, Dr. Nadia Tewes. Nadia is an infectious disease specialist and clinical lead COVID-19 network at CoHealth. She has been practicing in a diverse range of clinical environments for over 20 years, including Indigenous health, refugee and asylum seeker health, community health, and public hospitals. Since June 2021, Nadia has been clinical lead and chair of COVID-19 Network Clinical Governance Committee. This consortium of organizations provide COVID-19 testing and vaccinations for underserved communities through mobile units, pop-ups, and fixed site vaccination clinics. Nadia is also closely involved with a number of small migrant women's groups and strive to empower local multicultural community members to have equitable access to healthcare and employment. Today, Nadia will share with us insights around how in last 2 years, COVID-19 has evolved and the impact this has had on people's lives, especially their health. Welcome, Nadia. We are so honored to have you with us today.
Thank you so much for that wonderful introduction. I want to start by saying that I'm sitting on Bunurong land, in the land of the Kulin Nation in Melbourne. And wherever we are in Australia, we're sitting on Aboriginal and Torres Strait Islander land, and this land is unceded. And I want to acknowledge that unless you're Aboriginal or Torres Strait Islander in this country, you're a migrant or a child of a migrant. So thank you so much to the speakers that have come before me. Today, I've been asked to talk about 2 years into the COVID pandemic. How's it evolved and where are we going? So I think we all know that it started off in China and spread around the world. And to date, this virus has killed 5.7 million people and caused 300 million infections. My condolences for those of you who've lost family members or friends due to this pandemic. I'm currently looking after people with COVID at home through the Alfred Hospital 2 days a week. And I can see the impact of this infection, even in people who are not unwell enough to need hospitalisation. Some still feel completely wiped out by this illness. And if you're at home with COVID as well, I hope you're looking after yourselves. What we don't know is the impact on individuals and families and businesses who've managed to cope with the long lockdowns and periods of isolation and quarantine. Even if you haven't had this illness personally, we can't fail to have felt the impact of the pandemic. So back in 2020, we also heard about the inequity created by society, both overseas and here, through the Black Lives Matters movement. Of course, for those of us who've worked to improve health equity our whole lives, the message of Black Lives Matters was no surprise, but I was amazed to see so many in the Western world stand up against racism. Although in 2020, we also saw the hard lockdown in the high rises in Melbourne, where over 3,000 people were locked in their apartments in an attempt to prevent the spread of COVID. We also saw the largest numbers of cases of COVID in the most diverse suburbs in Melbourne. COVID's not supposed to discriminate, but it absolutely does. If you have more than 2 people in your family, if you work as an essential worker, such as in aged care or disability, if you live in more overcrowded conditions, if you're unable to take time off work to have a test, if there are no tests within close distance to your house, if you don't understand the way to prevent COVID because you've never had an information in a way that you understand, in a language that you understand, or in an accessible format, if any of these things, you're at most at risk of COVID. We haven't collected a lot of data to say exactly how the pandemic has shaped us in Melbourne. But what we do know is those from the lowest socioeconomic group were 4 times more likely to die of COVID than people who are rich. This was even irrelevant when you took age into account. They had 2.6 times higher rate of death, regardless of people's ages. I feel so privileged to be speaking with the businesses of Casey today and the people of Casey for Casey City Council. There's certainly a lot to celebrate. You are able to get through lockdown after lockdown. And moreover, you have had and continue to have the highest numbers of coronavirus infections in the state, if not the country. Why? Well, these are for the reasons I explained before. Casey LGA is one of the most geographically and ethnically diverse LGAs in the whole of Melbourne. Over 1 in 2 of you are essential workers. We need you, otherwise the whole economy would fall apart. 15% of you have more than 8 people in a house. And you're also in the top 10 of the most disadvantaged LGAs. You're also one of the fastest growing suburbs. And I read this week, 49 families moved into Casey this week, and there were 96 new babies. So if you've had a new baby recently, congratulations. I've also seen that the top languages besides English are Sinhalese, Punjabi, Dari, Mandarin, Hindi, and Hazaraki. Back in 2020, I looked desperately for information in some of these languages to explain to my friends' communities about COVID. But there wasn't any information in any languages except on a website. There weren't many community members employed to provide information, and there was a lot of mistrust from communities because they were not being communicated with. Thankfully, in 2021, we saw the availability of COVID vaccines. And when the vaccines started to come out into the community, I was also looking for information for those who'd missed out in the first waves. Are we going to prioritize those who are most at risk? Now, the technology for these vaccines had been in the pipeline for many years, waiting for that next big virus to emerge. And somehow the world got together, did the right trials and safety tests, and got the vaccinations out to 10 billion people. I started to see people prioritize depending on their risk of coronavirus infection. And I'm really glad that healthcare workers were prioritized. I'm a doctor in infectious diseases and my husband's an intensive care specialist. But what about those communities that were affected by COVID in 2020? Even in the middle of last year, I was told by several people who had a preferred language other than English, no one's getting the vaccine in our communities. Everyone's scared of it. We don't know anything. And then in August last year, as the rates of coronavirus were dramatically increasing in your suburbs and in the West, I could see a big gap where Casey was. You still had one of the lowest vaccination rates in the whole of Melbourne. Now, nothing's perfect, but I think we need to acknowledge how much has changed in the last 6 months and year. Thanks to the hard work of all of you working in COVID-safe businesses, providing information on vaccines, getting vaccinated, your LGA has a double dose rate of over 90%. Did you know if you're a country, you would be one of the top countries in the world for COVID vaccinations? I was lucky enough to be part of 5 community health organisations, IPC, DPV, each, Star Health and CoHealth, who were able to provide vaccinations through pop-ups and mobile units to where different communities were wanting to have them. We were able to speak to leaders in faith groups and community centres, organisations for people experiencing homelessness, and even set up in town halls for international students. We were lucky and contracted by the state government to provide care in a way that people were able to access and able to get people vaccinated. Now, some of you, and I hope not many of you, are still wondering, well, how good are these vaccines really? What do we know so far? Well, looking at recent information that's come out from the States as one example of many examples that have come out. In the United States, they believe that in 1 year, 1.1 million lives have been saved from dying of coronavirus. And they've saved more than 10.3 million people going to hospital. That's in the States. We have information here as well, but it's ongoing and evolving. It's important to know that when you're vaccinated, it's not just deaths and hospitalization related to COVID. When people have COVID and they're in the hospitals, it means that people who would normally present for treatment due to heart disease or cancer or lung disease aren't coming into hospital, aren't able to come into hospital. And it means that when you go into hospital, the hospital may not have room for you. We saw this happening overseas in so many countries around the world. And in Melbourne, it hasn't really happened. We are so lucky. Before, last year in August, before the vaccines were really available to everyone, we could see our intensive care units and hospitals filling up really quickly with people. Now, the case numbers are certainly very, very high, but compared to last year and the year before, we don't have as many people in hospital or dying or in intensive care as we used to. So what's coming up next? I don't think we really know. You know, different people are predicting different things. I'm not an epidemiologist or a mathematical modeler. What I do know is I think we need to be agile. We need to recognize that nothing is permanent and we sometimes don't know what's coming in the future. I think we've got used to that a little bit through COVID. I know many of you have got used to that through experiences in your own countries before you came to Australia already. What do we know? We have a new variant. Whilst it is slightly milder than the Delta variant, it's infecting lots more people. We know that 3 doses of vaccine work much better than 2 doses. And we know that children are the biggest spreaders of infections, but they don't get as sick as adults. However, we do need to protect them because some children will get sick. And if we prevent infections in our children, we'll prevent infections in our families and in our communities as well, especially for people with disabilities or people with diabetes or heart disease or cancer who can't fight infections the way others can. And we know that there's lots of kids who still need to be vaccinated. The last thing we know, and this is really, really important because it's just come out in the last few months really, if you get the infection and if you've got a low immune system or some other illness, there are new treatments around which can prevent you from getting sick. So treatments for COVID, it's extraordinary. So as I wind up, my take-home message is don't lose hope. We've come so far and most of us have got vaccinated. We locked down and we continue to wear masks and socially distance. Thanks to the hard work of everyone, we're able to celebrate with families and friends. We're able to get our hair cut and go to school. So for now, stay safe. Wash your hands, keep your windows open, get your third shot or your booster, get your children vaccinated. If you or your family have a cough or a sore throat or fevers, chills, runny nose, diarrhea, headaches, get a test. Don't worry. Let the government know so that you can get linked into healthcare if you need it. You'll have a nurse calling you or even a doctor like me if you need to. I've been looking after people at home via their telephones. Stay agile. Know that this virus is forever changing and the guidelines also change. This is part of the pandemic. We need to be flexible and listen to the experts. As new information evolves, we learn more and share this with our communities. We can do this and we can get through this. We're luckier than most countries with our health system and our resources. We should celebrate now and spend time with our loved ones. Let's keep each other safe. Thank you for having me.
Thank you, Dr. Chaves. What a great reflection and insight. This is why the COVIDSafe program was developed to reach out to diverse groups and business owners, disseminating the health information in language and to support the local businesses and community networks where needed. And now for our next speaker, Commissioner Andrew Crisp, APM. Commissioner Crisp is Victoria's Emergency Management Commissioner who has the responsibility of coordination before, during and after major emergencies, including the management of consequences of an emergency. He works closely with emergency management organizations, agencies, government departments, and communities with a focus on building and maintaining strong relationships and capability across the broader emergency service sector. Andrew has served as the Emergency Management Commissioner for Victoria since August 2018 and is with us today to share his experience from an emergency management perspective. Welcome, Commissioner.
Hi, I'm Andrew Crisp, Emergency Management Commissioner. Some of you probably more used to see me talking about fires and floods and storms. However, I have had a role over the last couple of years with regards to various parts of the COVID emergency. But I know what my part is, and I only have some understanding, some appreciation of the role that you've played. So when it comes to local government, so well done, Casey Council sort of pulling this together and this particular project, supported by the state government, the Department of Jobs, Precincts and Regions. But this is about you. This is about business owners, and particular small business, that in all honesty, over the last couple of years, when I've seen the stories about the impacts on small business, I don't know how you've managed to get through to this particular point. I can only imagine how tough it's been on you as business owners, the impacts on your families. And as we know, in this great part of Melbourne, great part of Victoria where you live and work, incredible multicultural refugee community. So again, but the point I want to make in relation to that, what we've really learned from an emergency management perspective over the last couple of years, and it's probably no surprise to me and no surprise to some others, but how those communities have come together so well to support each other. I've seen demonstration of various relief and food programs where the community themselves, as I'm sure you have been involved in, have actually accessed various food, your own delivery, distribution methods to get it out to those people in your communities, but not just your communities, more broadly all communities, those people that need that particular support. So it's a credit to communities that have really come to the fore over the last couple of years. But when it comes to small business, you have done it tough, and you have well and truly deserved the support that you've received. But we know there's still tough times to go. At the moment, I think today's cases, will be around that 7,000 mark. So there are a number of people still contracting COVID. Whilst it's really positive in terms of the numbers in hospital and those numbers are reducing, but there are still people that get sick from this. So it is an ongoing challenge for us, but it is about how we work together. We talk about in emergency services, and across our sector, we work as one. But I'm sure that's what you've been doing, working as one, working across various businesses, working with local government, other key stakeholders, and making sure that we're working as part of a team. Because when we work as part of a team, we can achieve anything. I often say that, in my particular role, I'll go out to a fireground or a storm, and people will say to me, I couldn't do your job. And I say, well, I couldn't do your job. I haven't got the technical expertise to get up onto a roof and make sure that house is safe from further weather impacts. And it's like you, it's what you do, it's the skills and the experience and the expertise that you bring to the fore as part of that broader team that will ensure that we're successful. So well done to all of you. What I do also say to our emergency services, because it has been a tough couple of years, I'm tired. We're all tired at the moment. We're getting through. We're definitely surviving, not thriving, and I'm sure we'll get to that particular point. But it is important that we look after ourselves, particularly if you're running your own business. I know it's difficult, but you've got to try and take some time out for yourself to have a break when you can. But more importantly, it's about putting up your hand if you're really, really challenging. There are support services that are available to you if you are struggling. So please. Never be ashamed, never be afraid to put up your hand and ask for help. So thank you. Shame we're doing this the way that we are, but I do look forward to coming out and spending time in your community with your small businesses, particularly if there's some good food going. So thanks everyone, take care.
Thank you, Commissioner Chris, for reminding our community and businesses to look after themselves as a team, as one community, putting their hands out when help is required. We want to remind our audience that if you or your business requires support, please reach out for help by visiting Council's website. There you will find information about resources and contact details of support services that are available. Our last keynote speaker for today is Commissioner Vivian Nguyen. Vivian is a passionate advocate for community engagement and diversity. For over 25 years, she has worked as a business executive and community leader in corporate, community, and government setting agencies. Her contribution was recognized in 2002 when she was recorded on the Victorian Honour Roll for advocating for women in leadership and work with Vietnamese young people. In 2003, she was awarded the Australian Centenary Medal. Commissioner Vivian is the chairperson of the Victorian Multicultural Council. She has sought to provide a platform for communities to voice their opinions despite the challenges that 2020 and 2021 has presented, and now hopes to partner with community to promote and inspire Victorians to continue embracing and celebrating our diversity and differences. Vivian, we warmly welcome you to this webinar as we hear about your insight on what have the impacts been on culturally and linguistically diverse communities during restrictions and COVID, and how has the COVIDSafe project supported CALD communities continue to work and celebrate their culture in a COVID-safe way.
Thanks very much for that kind introduction. For many of you who I haven't had a chance to meet, my name is Viv Nguyen, and I'm the chairperson of the Victorian Multicultural Commission. I'm sure I've met many of you online through Zoom meetings and the like. The impact of COVID in the city of Casey, I must say, wide and broad. And for a culturally and religiously diverse community such as your area, it's been huge. There's loss of income, the significant mental health and well-being that has been impacted by the extended isolation periods that we've had to go through to keep ourselves safe and the community safe. And for many of us, family violence was also on the rise. The challenges around homeschooling, And many of us, the way in which we consume or communicate are also very diverse. And we want to make sure that we try our best to understand the rules and adhere to the rules. But sometimes we have been uncertain about what the current rules were, whether or not we are able to access the information timely and in ways that are applicable and appropriate to us. We might not know where to access supports, information, and services such as food relief. I can only imagine the impact that has been felt and experienced by the community. And I can also see with that the level of compassion, resilience, and commitment that you have given to each other through your volunteering activities, thousands of those, whether it be on the phone, supporting each other, on the street, delivering food, or online, like these sort of gatherings, so that you can be kept informed and in turn inform your community. It's been a huge mammoth 2 years, and we are not yet over the pandemic, but I know that we are starting 2022 on a much more confident note because of the way we've worked together, because of programs such as COVIDSafe projects, that we are going to overcome this pandemic. Just another point I'd like to add to my response is that I'd really want to acknowledge the role of the local government, local business, faith organizations, communities that have been working together so well over the last couple of years. We are yet to overcome this pandemic, but I'm really confident that whatever variant comes our way or variants that come our way, the way that we've worked together will mean that we are on a much stronger path to overcome these challenges. I do want to thank you for that. And I just want to say that, keep it up. It's been difficult, but we are on a much, much more stronger path going forward. Thanks very much for having me here today. It's been quite a journey, but we are on our way there. And thank you once again for having me.
Thank you, Commissioner Nguyen. Indeed, Casey's COVIDSafe program has played a significant role. It's been an honor to have you with us today. Thank you for taking the time. Well, I'm sure you all agree, we have heard some enlightening insights and inspirational stories about our frontline workers, community leaders, emergency management teams. As we hear, we learn, and working as a team to stay strong. Well, that just wraps up our Stay COVID Safe, Stay Open webinar. On behalf of the City of Casey, I would like to thank you all for attending today. I leave you now with a few short clips from some of the community that have worked over this delivery of this project. Enjoy the rest of your day. Thank you.
Stay COVID safe, stay open. Stay COVID safe, stay open.
Stay COVID safe, stay open. பாதுகாப்பாக இருங்கள், கொரோனா அறிகுறிகளில் விழிப்பாக இருங்கள்.
រក្សាសុវត្ថិភាពក្នុងពេល COVID ធ្វើឲ្យមានដំណើរការបើកអាជីវកម្ម